Police determined that the residents had the television turned up loud and were watching Dr. Phil.
Hey guys, welcome back to Film Streak. Today we'll talk about why Alan and Dr. Phil secretly hate each other. Let's head into it. Number 4. Alan Pompeo shared her opinion.
You're obsessed with my app, Heads Up.
Which I didn't know. Look at you, another thing. Could you stop with the things and inventions and fantasticness?
Alan Pompeo, 50, took to Twitter on April 18 to speak out about her thoughts on the importance of staying home during the COVID-19 crisis, and also shaded Dr. Phil McGraw, 69, and Dr. Drew Pinsky, 61, in the process. The Grey's Anatomy star pointed out how being in quarantine can help stop the spread of the highly contagious virus to healthcare workers and others, and called out Dr. Phil and Dr. Drew for their previous controversial comments that some feel downplayed the seriousness of the virus. Staying home is for very good reasons. One of them is to stop the spread to nurses and doctors and anyone who works in a hospital, housekeeping, security, maintenance, to keep their risk of contracting lower, and the hospitals, they can only handle so much intake. Ellen tweeted in one of a series of tweets on the topic after seeing news stories about protesters marching against the stay-at-home orders in California. Number 3. Then she called out old white guy TV docs. In a tweet, she stated, "Also the old white guy TV docs who say stupid selfish should, yes, walk that right back to your lazy boys and sit your stupid asses down in your living rooms, on your golf courses where you live. Tired, out of touch old fools, don't get me started today," she continued. So let's think about all our first responders and healthcare workers, home health aides, nursing home staff, always. It's a much better place to put our focus. She went on to talk about the effects on sexism, racism, and other struggles that healthcare workers have to face every day before circling back to TV doctors and their careless statements. Also, to those out of touch TV docs, which I'm sure they would call me, you took an oath so many years ago to do no harm. Making careless statements in this environment when so many healthcare workers are suffering physically and emotionally is defying that oath, she wrote. Alan's tweeting storm didn't stop there either. She concluded by replying to another tweet that called out Dr. Phil, Dr. Drew, and Dr. Mehmet Oz, 59, directly for not acting like real doctors. I love this because they've been so busy in their dressing rooms getting their faces powdered and worrying about their ratings. They have no idea what doctors and healthcare professionals on the front lines actually do, or they just don't care, her response read. Number 2, she responded to a tweet with pictures of the aforementioned TV doctors. Alan's tweets come after Dr. Phil and Dr. Drew both made headlines for some comments they made about COVID-19, aka the coronavirus, after the pandemic started in Wuhan, China in December. Dr. Phil compared people dying from the virus to people dying from car accidents, drowning, and other things when he criticized America's stay-at-home orders. 45,000 people a year die from automobile accidents, 480,000 from cigarettes, 360,000 a year from swimming pools. But we don't shut the country down for that, but yet we're doing it for this. And the fallout is going to last for years because people's lives are being destroyed, he said on Laura Ingram's show on Fox News on April 16. He later apologized for his choice of words after receiving backlash. Dr. Drew received similar backlash after he initially said he thought the virus wouldn't be more serious than influenza, aka the flu, in a video that was filmed back in early February. He also apologized later on April 4th and admitted he got it wrong. As of April 19, COVID-19 has infected 2,365,269 people worldwide, including 162,129 cases, resulting in death. Number 1, what you should know about the virus.
But I heard, is that
I'm really good, I
Is that really true? You've never played sober?
No. Yes, it's true.
Given the tweets, everyone should know some basics to why the TV reality star doctors are just wrong. Strict measures are critical for slowing the spread of the disease. Public health efforts have been aimed at flattening the curve. If you map the number of COVID-19 cases over time, the expectation is that it will peak at some point. On a graph, this peak would mirror a surge in patients, which could overwhelm hospitals and healthcare providers. Flattening the curve would mean there would be fewer patients during that period, and hospitals would be better able able to manage the demands of patients who are sick with COVID-19 and other illnesses. Infection prevention is key. There are many things you can do to protect yourself and the people you interact with. Wash hands with soap and water for at least 20 seconds. Dry them thoroughly with an air dryer or clean towel. If soap isn't available, use hand sanitizer with at least 60% alcohol. Stay home if you're sick. Avoid touching your nose, eyes, and mouth. Use a tissue to cover a cough or sneeze, then dispose of it in the trash. Use a household wipe or spray to disinfect doorknobs, light switches, desks, keyboards, sinks, toilets, cell phones, and other objects and surfaces that are frequently touched. Create a household plan of action in case someone in your house gets sick with COVID-19. Plan visits with friends and family outdoors. If you are going out in public, bring a cloth face covering to wear over the nose and mouth, tissues, and a hand sanitizer with at least 60% alcohol. Experts are working rapidly to find solutions, but until then, we need to protect ourselves and others from this disease. This brings us to the end of our video. I hope you enjoyed it. Hit like if you did, and don't forget to subscribe to our channel so that you don't miss any of our videos in the future. Also, watch the 2 videos that are on your screen because I'm sure you'll love them. With that, I'll see you in the next video.